We now have joining us on the phone lines from New York, Dr. Scott Price. Doctor, great to have you on the show. Thanks so much for calling in. I know you've got a busy schedule back there.
Well, it's a pleasure. Gives me a moment of a break.
I'll bet, yeah. And I understand you're actually talking to us. You've got a face mask covering your mouth right now. You're at Mount Sinai Queens Hospital right there in New York City. Is that where you're at?
That's correct, yes. I've been here at Mount Sinai Queens for the last 3 weeks, assisting in their COVID relief efforts, trying to help give their physicians a little bit of a breather at times.
What's it been like over the past few weeks?
Well, when I first got here 3 weeks ago, it was really quite busy. The hospital, I think, normally runs about 150 inpatient beds. And it was, when they were having their surge, they were having anywhere from 190 to 220 beds. But when I got here, it was down to about 154. And now in the last week, it's actually been nice in that the number of admissions occurring has been going down. So we're trying to get the patients that have already been infected and in the hospital, hopefully getting them to recover and be able to get out of the hospital.
So that's good news, and it sounds like even New York is hopefully making a turn for the better.
It does. It looks like that the number of admissions is going down. I was last week. I was the admitting physician in one of the admitting physicians in the emergency room, and it initially was busy, and then toward the end of the week, it was getting lighter and lighter, and now it's the number of admissions is going down. So hopefully that will stay that way and stays a positive or a decreasing trajectory for us.
How'd you end up getting called up to go to New York?
Well, I got back from serving a mission for my church, for the Church of Jesus Christ of Latter-day Saints, and then I thought, well, what am I going to be doing? And right after that, the COVID stuff started breaking out. So I signed up for the Montana Healthcare Mutual Aid System, where providers can sign up and then they can mobilize you to, if you need it in Gallatin County, they send you to Gallatin County, or if you need it in Cody, they could share you to another state. And then all of a sudden I got an email saying, hey, are you available? And I had called my former residency training program in California and said, are you folks needing anything? And they were in pretty good shape because they kind of nipped it in the bud there in California. And then I got an email and said, are you available? And I go, sure, I'll go to New York. And fortunately, my wife is quite a wonderful and supportive lady. And she said, all right, if you want to do it, go.
Dr. Price, again, great to have you on the show. I understand you're running for Senate District 25. Talk about just the decision to put the campaign on hold and why you decided to run for the state Senate in the first place.
Well, I decided to run for the state Senate just because I think the Constitution is the greatest document that's been created by man and gave us a chance for the people to govern themselves. And that's why I joined the military years ago and served in the military. And then as a doctor, I obviously served that way. But I thought, well, my country's been good to me. My community's been good to me. How can I give back? And I thought, well, I can run for the legislature and try to serve in that manner. And so I started that, and then the COVID outbreak occurred, and I thought, well, yeah, I should probably do something about that since I can't get out and walk the streets and knock doors. So I decided to go ahead and try to offer my services and volunteer in the relief effort in New York.
Yeah, what's been, I guess, the most compelling thing from your personal standpoint, just being there on the ground and seeing it firsthand?
Well, the most amazing thing to me was how vacant New York is. I'm not a much experienced traveler in New York, but when I got to JFK Airport, there wasn't anybody to ask, how do I go find the tram so I can go find a rental car so I could get to my hotel? And good thing is, when I drive out on the roads, there's nobody to honk at me when I don't know where I'm going. But the thing about the hospital was I'm serving at Mount Sinai, Queens, is probably as ground zero for the outbreak in New York, because Queens has John F. Kennedy Airport and LaGuardia Airport, and then has the largest percentage of taxi drivers, Uber drivers, and MTA personnel in all of the boroughs live in Queens. So you had probably an inoculation from the air traffic into the city, and then all of the drivers are running around and taking these people around, and the drivers get it, and they took it home, would be my guess. And so it really became a prominent problem in Queens before they really had a chance to shut it down. So Queens got hit pretty hard, and this hospital's been pretty much brimming. Other hospitals, like in Manhattan, not so bad. They're a little bit further away. Excuse me.
I should say too, if you get an announcement and you need to run, we perfectly understand. So feel free to interrupt us and say you got to go if you need to go, because we're happy to talk with you as long as we can. But also understand if you need to run. You were telling me during the break that just what it's like wearing all the protective equipment inside the hospital rooms, especially for a Montana guy, gets a little hot in there.
It does. I joked with the nurses. I said, if you walk into a room one time and you see a puddle of water, some blue scrubs, and a stethoscope, you go, "Hey, Dr. Price, something happened to you there?" I feel like a snowman melting in summer, because it gets above 60 degrees, and I get warm. But yeah, we've got an N95 mask, another mask over that. We got a face shield and a headgear and a gown and gloves. So it gets pretty warm in these rooms caring for these patients. But otherwise, it's a good opportunity to serve. And the nurses here are wonderful. They're very helpful. The doctors are grateful for the relief. The patients are extremely grateful, and so are their families. Families aren't allowed to visit them because of the extreme risk of all of these patients infecting a family member, because nearly every patient in this hospital has COVID, and so they are not allowed to visit. So we make phone calls, we put them on our cell phones and let them do FaceTime or say hello to their families, those that don't have their own cell phones. And that's good. It's nice to be able to help out and make somebody feel a little bit better.
Dr. Scott Price, I know the question a lot of folks have is, you're putting yourself at risk by going right back there in New York City. Talk about how you've dealt with that. Well,
sure, it's a risk, but again, I'm trying to be prudent and conserve or protect myself all I can. Whenever I'm walking around outside, I've got a mask on. I rented a car, so I don't have to take the metro or a bus and protect myself that way. When I'm at the hospital, I'm pretty much every patient I deal with has COVID-19 infection, so we use full personal protective equipment. I've got an N95 mask, got another mask over that to protect and keep the N95 clean from any droplets. Got a cover over my head, a splash face shield, a gown, a couple sets of gloves. So we're using good personal protective equipment. Hospital is putting in reverse negative air pressure rooms. They take out a window and put a negative pressure ventilation system, so it's sucking air out of the room and pushing it out into the outside, so that it's minimizing the concentration of any virus that would be circulating in the room and in the hallway for nurses, staff, etc. So I think everybody is doing the best they can to minimize the risk, and we're just trying to be wise and prudent and follow the best guidelines that we can to keep ourselves safe.
All right, and then I know you'll have to quarantine once you get home as well. That may be the hardest quarantine yet, but either way, we're grateful for you joining us on the show this morning. Dr. Scott Price, candidate for State Senate District 25 here in Montana. Also, is there anything else you want to tell folks, or is there something that you think folks really need to hear right now?
Well, I'm really glad and grateful that Montana is going to get to start opening again, because people need to get back to work and stimulate our own economy and let people have their livelihood. Yeah. It's still, there's a virus out there, and older people who are at risk, they can still be wise and stay a little bit out of circulation, avoiding large groups of people in crowds. It still would be perfectly appropriate and socially acceptable for people to wear a mask and protect themselves. We can always wash our hands well, wipe down surfaces that are touched, so we can still use our good judgment. We don't need the government to tell us to do that. We could just do that and then try to open up our economy and get us all back to work.
Yeah. It seems like we need to figure out a way to do both: protect the vulnerable and get the rest of our economy back to work. Hey, Doctor, actually, if you can, I got a caller on the line with a question. Do you have time to take a quick question as well?
Sure.
Okay, great. Let's see, Mike in Big Timber, are you there?
I'm there. Thank you.
Thank you. Yeah. Did you have a quick question or comment?
Yes, doctor, thank you for your service and what you do. Could you tell me, is there a special treatment that is being applied to the victims of COVID, such as hydrochloroquine, or is it just isolation? Could you tell us what the treatments are being applied to the patients?
Great question. Yeah, thank you.
That is a great question. The Mount Sinai system has tried to be very proactive. They've had probably one of the largest patient populations in the nation. So there are several protocols that they have developed. And yes, hydroxychloroquine is used regularly to help treat these patients, as long as we have to do an EKG on them to make sure that their QTC, a special tracing time frame on the EKG, is okay. And if those patients' EKG is okay, we put them on hydroxychloroquine. We also, if there's any sign that there may be a possibility of other infection, we put them on antibiotics for community-acquired pneumonia, such as azithromycin or Rocephin, if there's an indication whatsoever that maybe there's a secondary process going on. And if the patient is coming from a nursing home where they have exposure to other microbes and having possibility of a healthcare-associated pneumonia, then we put them on bigger gun antibiotics as indicated. We have the infectious disease specialists see most of these patients and help watch them. Pulmonary specialists see the ones that are also have the greatest involvement in the COVID pneumonia.